Mom, you have no audio. They can't hear you. I guess if people can hear me, I might as well be talking. Let us know when you can hear Mom again. Welcome to Med School for Mom, everybody. I guess my mom did a little bit of an introduction there that maybe you haven't heard. So I'll redo it. She's much better at it than me. If this is your first time tuning in, this is a show that we do just out of fun. There's usually a little thing that scrolls at the bottom that says you can't sue us or use any of this information.
The disclaimer.
The disclaimer. Apparently it's not there at the moment.
It was there though, so
yeah, so you can't sue us. I started during COVID. We started doing this show, and I've been teaching my mom little bits of medicine and bringing in guests. And this is Owen. He's a doctor with me here in Australia, and we're gonna do some medicine today. So it's a good show. Tonight we'll be taking my mom through a night shift. It's her first night shift. She learned about the heart and the past and the lungs and the kidneys and the abdomen and the brain, and now she has to put it all together and work through her first night shift. In addition to the teaching, usually starts with show and tell for some reason. I don't know how that started, but we do show and tell.
It's school.
It's school. It's med school.
You do show, yeah. Even in med school, we always did show and tell.
You gotta do show and tell.
All 300 of us.
We'll start with our show and tell. Owen has something that I'm not a fan of Owen's show and tell today.
My show and tell is my favorite. So what I've got here is an ID card for a hospital. This was Tommy's ID card when we were doing one of our rotations. And this comes up on my phone every time he calls me, so it's very special to me. We'll just try and see if you guys can see it. So that's
it.
TommyMoran.
This is real.
Medical student. That's a real thing that was really made and then given to him.
Yep.
By the administrative staff at that hospital. So.
And I didn't notice, and I wore it for about a week or two.
You got to tell the story while we've got some time.
All right. While mom's still playing with her, they obviously made a mistake when there's a typo on the card.
Show it again.
We don't have to show it.
We could show it again. I think we should show it a few more times.
I was sitting in with the attending who was speaking with the mom, and then there was a kid, like a little 5-year-old kid, an absolute brat. Just like playing with the toys in the corner, but throwing the toys around and screaming. And so anyway, I tried to just calm down the kid so that the mom and the doctor could talk. And the kid was very mean. And the kid said to me, "Why would I listen to you? You're a moron." And I was wearing my badge, which I hadn't noticed had a typo on it at the time. And I said, no, it's pronounced Moran. And then this 5-year-old kid pointed to my ID badge and says, "No, it says moron." And that's how I noticed my name badge said moron.
Did you realize right away though? Like, did you look at it?
I turned over my name badge. I was going to point out to her there's supposed to be an A, but
so what does the attending do in that scenario?
Everyone laughed at me.
You're done after that. You gotta go home.
Yeah,
it's over.
That was
your day's over.
Can you chat here, Mom, now?
In the chat, hear me say yes.
Yay!
Hello, everyone. Sorry about that. So what Tommy was trying to tell you was I got a new computer and I had to completely reset my OBS, and obviously we missed testing that I had the microphone connected properly. So I do have a show and tell I have to show.
You have to do your show and tell.
And I have a show and tell because we had a very sad thing happen in our family this week. We lost our dear family member, our dog Wilson, and he was a very good boy. And so, in honor of Wilson for today, I would just like to show. I'm going to show a picture of Wilson with his cat son, Elvis. He was a good boy. Can you see that? Okay. So that's Wilson last year when the cat was just a kitten. That's him with his baby cat.
I love that.
He's such a good boy, and we said goodbye to him on Tuesday. So that's my show and tell. And I don't want to be sad anymore, so let's start class.
All right. Well, this will make you happy. Pop quiz.
Why is there a pop quiz? I thought the whole show was a quiz. What the heck?
No,
Is this what med school is like?
Mom, GFR. What is a GFR?
We haven't covered GFR.
You just used the words before the show started. Kidneys.
She was showing off.
You were showing, I had to do something.
GFR? I used GFR?
before the show, you said, what is the glomerular filtration rate?
Oh, yeah. But I was probably reading from my notes when I was looking at it.
I know you were.
Of course I was.
All right.
No.
That's okay. You're allowed to use your notes, and you're allowed to call and ask for help. So today we're doing our first night shift, and you're covering for the surgical ward as well as the medical ward.
How many patients are on the ward?
40 med beds and 40 surge beds.
And they're all going to sleep through the night, right?
And then we'll find out, won't we?
It's a quick episode.
you just sleep through. All right, Mom. Night shift, 9 p.m.
Night shift.
There we go. Hand over. All right.
Okay.
So Owen will play the role of all the people that you interact with tonight. You are allowed to call for help.
Okay.
All right. So you do have registrars that are at home and they're sleeping. And if there was an emergency, you could call them and get them to come in, or you could call them and ask for advice. All right. So you can do that. So you have a surgical registrar that you can call for help, but he's at home sleeping. And there's a medical registrar you could call also at home sleeping.
And you can also call an emergency call as well if you want. You can call like the ICU team. They'll come and help.
All right. So Owen's going to hand over some of the jobs.
James Jameson is back again. He's in all the time, that guy.
James Jameson, troublemaker. All right. My name is Tommy. I'm the day intern.
Oh, wow.
What's your last name, Owen?
Thompson. Tommy Thompson.
Tommy Thompson.
So I've just got a few things to hand over to you tonight for your night shift. We've got Sally Salzberg in bed 43 up on level 8 tonight. She's 33 and she's had some abdominal pain 4 hours ago. I just didn't get a chance to, go and sort that out. So if you could, have a look at her, that'd be fantastic.
She's been in abdominal pain for 4 hours and she hasn't seen a doctor?
Don't judge the evening doctor.
I was really busy today, actually. I was just flat out. Now you're coming here and telling me this. Lots of people had abdominal pain, okay?
Okay. So has she had any medication or anything, or she's just been left in her room?
Look, I don't really know. Level 8's a long way from here. We're on level 1, so I haven't made it up there yet. Can tell you about the next patient.
You're getting judged. You're getting judged.
James Jameson. So 89-year-old guy. He has some heart failure and he's had some ischemic heart disease. He's been anemic while he's been here, so we're giving him a unit of packed red blood cells now. That's just going to finish at 11 p.m. Just because he has heart failure, if you could go and fluid review him after he finishes his red blood cells, make sure he's not getting overloaded or anything like that. That'd be fantastic. We definitely want that to happen tonight. Then we've got Gary Gargles. Gary Gargles, we're sending this guy home tomorrow. The attending just wants a discharge to be finished before he goes home, and he's an early morning discharge. So if you can just tidy that up on your night shift.
Going home with any medications, prescriptions?
Oh, I didn't really think about that. Yeah, if you could do that as well.
Good question, Mom. Good point. Yeah.
Right? What kind of a doctor is it? Okay, Peterson.
Hey, Mom.
I'm a normal
be
Tommy.
Nice.
I'm a normal Tommy.
Be nice, Mom. Wait till you see what happens to you this shift.
All right, Peter Peterson, 77-year-old male.
Yeah.
And he's post-op a hemicolectomy, so part of his colon's come out today, and the nurses wanted me to review him because he hadn't passed any urine for 2 hours, but I haven't got around to that. So just letting you know that that's happened as well.
Does he have a stoma or not?
Oh, that's a good question. Yeah, I don't know about that either. So you can go on and have a look at him.
Okay.
You're asking a lot of questions. I'm just trying to get home. I've got dinner, so.
Okay. All right. Understood. Kyle.
Okay. Kyle McKyle, type 1 diabetic. He's fasting because he's having surgery tomorrow. I don't know what type of surgery. All I know is that this man has diabetes and that he's, we want you to call endocrinology to get an insulin plan for him. What we're going to do for his insulin while he's fasting. Right now it's just being withheld. Does that sound good?
Yeah.
All right, Mom. There you go. You're on your way. You can start your shift. Where do you want to
All
go?
right, Tommy Thomason's going for dinner. See you later. I'm out.
Tommy's
All
out,
good
Mom,
job,
you're on your
Tommy.
own.
Okay, I'm gonna. What time is it now? It's just a few minutes past 9, I guess. So I'm gonna go and
Hand
I'm gonna
over-
go see
hand over
Sally
Tommy.
first because Sally's been in pain for 4 hours. So I'm
You
gonna
want
go.
to see Sally first?
Look,
Eighth
I think that's
floor.
a good idea.
You're going to level 8, Mom. You're going to bed 43. You're going to go see Sally. We like it.
Okay.
All right, Mom, you're Sally Salzberg.
I've seen her before too.
Yeah, I've seen
I
her
can be
before.
Sally.
So she's
There's an admission note there. It says that she's a 33-year-old lady. She's been admitted today under the surgical team for abdominal pain for investigation. It is a right-sided abdominal pain that's been going on and off for a few months. It's worse when she eats particularly fatted foods. She has had some bloods done, and she's meant to have a CAT scan, but it hasn't happened yet.
Hi, I'm Sally.
Oh, hi Sally. Where is your pain exactly?
Oh dear, my pain. It's up in the top right of my tummy.
In the top right of your tummy. And
Oh,
on a scale of 1 to 10, how bad is your pain?
maybe a 6
It's a
right
6.
now.
Let me see. Do we have some blood work done?
Before we go to the blood work, would you like to examine her?
Oh yes, nobody's examined her at all. I'm sorry, of course. Yes, I'll examine her.
She looks uncomfortable.
Yeah.
These are her vitals.
Her blood pressure is 140/60. So her blood pressure is high. Her heart rate's a bit high for someone that's laying in bed. That's not great. Her oxygen saturation is good, and she is tender in the. That's not the epigastric is the top center, isn't it?
It is.
And Sally, you said your pain was worse when you ate fatty foods.
Oh yes, definitely.
Okay.
What are you thinking here, Mom? What's
I'm
going
starting
through
to
your
think
mind?
it might be gallbladder.
I like that.
Very good.
Oh, what happened to the blood work? Didn't I have some blood work for Sally?
You did have blood work, I think.
Oh, you know what's happening right now?
What?
Mom, your pager's going off.
Oh no.
Uh-oh.
Okay.
So you got a page, Mom.
Yeah. Well, that's good because I'm in bed 43 right now, and that's bed 44. That's right next. Okay, I'll answer that page.
All right.
Just 1 minute, Sally. I'll be right back. I'm just gonna
Okay.
step out in the hall for a second here.
All right. So
I
this,
mean, okay.
this is the page. Mom, it says bed 44. Potassium is 5.9. Please review. And there's a number there.
And do I know who's in bed 44? Some other patient or one of these other ones?
This is all you get.
That's what you get.
That's your page, Mom.
That's okay.
You have a phone number there at the end, though.
You can call that person.
There's a phone number there? Well,
Yeah.
I gotta call the phone number because I gotta find out if this is more important than Sally here.
All right.
Good thinking.
All right, sure. Let's find out.
I'm not just running over there until I know.
I'll turn up my volume.
No.
Hello.
Hello?
Oh, hi. This is Jack. I'm the nurse for bed 44.
And what's going on in bed 44?
Oh yeah, I just sent you a page. His potassium's 5.9.
Okay. And what are his other symptoms? What was he presenting with?
He's a chronic kidney disease patient. Yeah, that's what I know about him. Yeah.
Okay, what's this patient's name, just so I know?
Their name is Frederick McHands.
Frederick McCanns. Okay, well, I don't know, guys. I'm not running over to see a guy that's got high potassium. Am I?
Yeah. It's usually a little bit. It's like this before he has dialysis. It looks like.
And when is he scheduled for dialysis?
Oh, he's gonna have some dialysis tomorrow.
He's gonna have dialysis tomorrow. Okay, well that's
Yeah.
good.
I mean, normally we would just do an ECG. I can do one of those if you want.
Okay, if you could do an ECG, that would be wonderful.
All right, thank you. Bye.
Okay,
All
bye.
right.
Okay,
What are you gonna do, Mom?
I'm staying with
I'm
Sally.
sorry. Oh.
All right. So you did want to look at the bloods for Sally, and these are the blood tests for Sally that she had earlier today.
Okay.
They are all normal. I'll walk you through it though. This is her hemoglobin. That's her
Right.
blood count.
Right.
So that's a surrogate for how many red blood cells she has, and that's normal.
Yep.
These are her white blood cells.
Yep.
They're not elevated. Platelets help the blood to clot,
Yep.
and they are normal.
Yep.
Her electrolytes, her sodium and her potassium are normal. Her creatinine, which is what we use to calculate the GFR, an indication of how good her kidneys are doing. So her kidneys are fine. These are her liver function tests. So these are enzymes that get elevated when there's something wrong with the liver, and they're normal. This is her lipase. It's secreted by the pancreas. It's elevated if there's an issue with the pancreas, but it's normal. And her CRP, which is a marker of inflammation and infection, that's also normal.
Okay.
So they're all normal.
Okay.
What would you like to do?
Oh my goodness. Well, I'm not used to having all that stuff be normal. I'm gonna call a friend.
If you want, you can speak to the surge reg.
All right, I gotta call a friend. I don't know what's going on.
All right, let's call the surgical registrar.
Hello. This is Connor. Surge Reg.
Hey, Connor. I have a patient here. She's a 33-year-old female. She has abdominal pain in her.
Oh, Sally. Yeah, Sally. I know Sally.
Okay, you know Sally.
Yeah.
I need some help here. All her blood work came back normal.
Yeah, I saw that. What's her CT show?
Oh, the CT scan hasn't come back yet.
Oh, okay. Yeah, get the CT scan, all right?
Do I have the CT scan yet? Can I get
just get the CT scan, all right? I'm going to go back to bed now. Okay, bye.
Oh, guys, this can't be what it's really like. Okay, give me the darn CT scan, Tommy.
Well, Mom, you got to move on with your shift. She needs a CT scan. It'll happen when it happens. You can call radiology if you want to tell them to make it happen sooner.
All right.
You don't have to.
Okay. Well,
It's
I'm sorry. Can I give her something for pain here? Can I give the lady something for pain?
Good. No allergies. Good. You give her some Tylenol. That helps.
All right.
She's happy and she wants to go to sleep.
And you call the radiographers and you ask to make the CT happen sooner, and they say okay.
Okay, that's good. All right. I'm gonna leave James a bit because I gotta check on him around 11 o'clock or before there.
10:45 p.m. now. All right.
Oh, chest pain in 69. I better go there next. Okay.
Okay, you want to go straight to the chest pain?
I'm
I like
go
that.
Straight there. Chest.
You're gonna ignore the other jobs you have. Yeah.
I'm going there.
This is Joey Jojo Jr. Shabadoo.
Yep.
Jojo.
And he has chest pain.
Okay.
So you got Joey Jojo's bed.
Poor Joey Jojo. All right, he's got chest pain. Have we done an EKG on him yet?
We'll show you his ECG in a minute.
Okay, Joey Joe, how are you doing? Where's the pain exactly?
Sandwiches.
Sandwiches.
It's
Sandwiches?
okay.
All right, Mom. What?
Do I need to be checking out to see if he's not?
You want to read his notes? He seems to just be saying sandwiches, so you have a look at his notes.
Okay. Non-English speaking. Okay. D4 post-op knee replacement. Had leg pain yesterday.
He's day 4 after a surgery.
Okay.
He's had his knee replaced. Okay.
So he had some leg pain, and now he's having chest pains. Okay, so I'm really concerned that he may have a clot or something. Yeah. So now can I see his ECG?
Well, you have examined him. You did ask to examine him.
His blood pressure is a little bit elevated. His heart. This looks like the same.
There's a little bit of copy pasting. There's a little bit of copy.
The same respiration rate. And his blood oxygen saturation. So I don't know. 95 could be in the normal range for this guy.
So his respiratory rate is 33.
Yeah.
And 33 is fast. His oxygen saturations, which we measure on this little probe on the finger, is 95%. But he's also wearing nasal prongs that are giving him oxygen. So that's 2 liters
so that's low then.
of oxygen. That's 2 LNP, 2 liters of nasal prongs. His heart sounds are dual. You hear no murmurs. His breath sounds are normal. You're very astute and examine his leg, and indeed he has a tender right calf.
Okay.
Swollen. Yeah, really
good. Is he on any kind of blood thinners?
Oh, great question.
Good question.
So we would normally have a post-operative patient on a blood thinner.
Okay.
We normally would.
Yeah.
Just an injection, usually into the abdomen, at least once a day. And
Okay.
it looks like the home team had not charted this for this gentleman, so he's not on a blood thinner.
So he's not on the blood thinner.
And you wanted his EKG, Mom?
Yeah.
This is actually a very abnormal ECG. I grabbed the bad one.
Okay.
But
So
just
they
pretend
have, they would normally give him blood thinners, and it's not showing on the chart that they have done that. So
Yeah.
that could be
all
what the
it has
problem
charted
is
is
right there, right?
Yeah.
Yeah.
Agreed.
Yeah.
Agreed. We would normally start blood thinners after
Yeah.
surgery.
So should I give him just blood thinners, or should I give him a clot buster medication now?
So probably just the blood thinners is how we would normally treat it.
Okay.
Or do you have to do another test? Or do you want to call for help?
I better call for help because I don't know what the next test is.
All right.
Okay.
So he's also under the surgical team. So we will call the surgical registrar.
Yep. Here comes the hat.
It's Connor, Serge.
Yeah, so I'm here with my patient, and his ECG is normal, but he's
What's their name?
4 days post-op surgery. I don't know, is it Fred McCann's? I can't remember what the name of this dude. Did you guys tell me his name? Oh, yeah. His name's Joey Jojo Junior Shabadoo.
Oh yeah, Joey. Yeah. Yeah, how's he doing?
No, he's having some pain in his chest, and he's also got some pain. He had pain in his leg, and his leg is tender when I did the touch. His chart doesn't show that he's on any kind of blood thinners for his post-operative. So I'm just wondering what I need to do next. I think he needs some blood thinners, but before I do that, what's the next step?
Yeah, get a CT, all right, and let me know what it shows. All right. Thanks.
Thanks very
Bye.
much. Tommy, can we order a CT scan on this guy too? Like,
Yep.
and
You're gonna
get
get
those
CT
guys
scans.
get a move on this.
You called down radiology. They're already a little grumpy with you from you hassling them about that other scan you want. But they say, okay, what kind of CT do you want?
A CT scan of his leg. No,
Where-
of his chest?
where-
I don't know. I want a full body MRI.
Now they're really unhappy with you.
This is America. I want it all.
This is America.
All right, Mom. They'll get you what's called a CTPA. All right, so it's a CT of the chest to look at the pulmonary arteries, the arteries that go to the lungs.
So there's a clot in the leg, and that piece of it's gone up to the lungs too. That's what
Exactly.
we're checking for? Okay.
That's right.
Okay.
All right, so that's
Joey
Joey.
Jojo. Okay.
Here's the time, Mom. You're trying to sort all that out. Now
Oh
it's
shoot!
12:05.
It's 12:05. Okay, I gotta go. I gotta go check on oh my goodness, on the heart failure dude, on James Jones, please.
There's a page, Mom.
Can't find patient's phone. Okay, I'm ignoring that one. Let's go. Bed 24, patient's red meds not charted. I don't know who's in bed 24. I'm not worrying about that. Can we go? I need to go right away to see James
one second.
Jones. Bed 33 use deep heat cream for toothpaste? Oh dear. Okay, that's it. I still want to go see James Jones. CRP4. Oh, it's 4?
Yeah.
And somebody's sending this to me? What is the matter with this person? Get back to the person that sent that text from bed 11 and tell them not to bother me unless there's things out of the normal range. It's the same person calling all the time. What is the matter? Who is this person? Bed 12 has a blocked nose, feels oxygen is not going through. Go and check and see if he's got like a smarty stuck up there or something, and let's move back on to. I want to see James James. He's 89 years old. I don't want this guy to die on my shift. Let's go.
All right, but radiologists called you. They have the results of the CAT scan you wanted.
Can I look at this while I'm walking over to James James's?
Now you have to go sit at a computer.
I gotta sit at a computer. I can't look at it on my iPhone. What kind of a rinky-dink hospital is this? Okay.
Good question.
Sally, what does the scan show?
Can you see my mouse on the screen?
Yep.
This is lumbar spine.
That's your spine. Yep.
The right side is reversed, remember? So this is the right side of the patient.
Yep.
This big thing is the liver, and then this is the little sac that sits on the liver.
The gallbladder.
All right, and there's all these little white spots in the gallbladder.
Yeah, she's got to go and have gallbladder surgery then.
Is that what you want to do now then? You're going to take her to surgery?
Well, I'm not doing the surgery.
So what are you going to do?
Well, I'm going to call a friend.
All right. You want to call the surgeon?
I need
Is that what you want to do? You want to call the surgeon?
a surgical consult. Someone's going to have to come in and help me, because if she's going to need her gallbladder out, I'm not going to be taking it out.
We'll call the surgeon then.
So let's go and see Jones. I'm over an hour late for this dude.
Yeah, Mom, you have to talk to the surgeon.
Oh, okay.
Corner surgery.
Yeah, the CT scan is back on Sally Sallerson, and she's got a large number of gallstones. And
okay.
I need a surgical
Faster and
consult.
book the OR. Is this the same intern?
Yes, and I'm bloody pissed at you guys for not getting stuff done during the day. Okay.
All right, faster and book the OR. We'll take her in the morning. All right.
In the morning, she's been here for hours. She's in pain. Get your
You want me
butt
to come in
here
right now?
and do the surgery now.
Mom,
What kind of a hospital is this?
this is boss.
We won't have the theater until the morning, okay? Can you book the theater and
It'll be
faster?
booked for 5 a.m. Be there or be square.
All right, good job, Mom.
Come in with both barrels down the phone for the surgeon. I love it.
Poor Sally.
Bossy right there.
Okay, can
All
we
right.
please go see...
Wait, Mom, look. There's an emergency call for bed
Is this
69.
Joe Jameson? But I really want to go see
You were just at
Jones.
bed 69.
Can I get
Met
a
call.
nurse or someone to go check
Bed
on James
69.
Jameson?
Medical emergency team to bed 69.
Okay, all right, okay.
That, Mom, you can't ignore that.
Off we go,
All right. Go see Joey Jojo.
Joey Jojo Shabu.
All right.
What's going on, Joey Jojo?
Oh, sandwiches?
There's a bunch of people around. There's a nurse there, and the nurse has called the medical call. You can talk to them.
Okay, yeah. What's going on with Joey Jojo? We were waiting for a CT scan on him.
Am I the nurse?
He was
Yeah, I'm
having
the
some-
nurse.
You can be the nurse.
Yeah. So his obs are in Met call criteria. So you didn't change it. So we've called a Met call.
You have to call an emergency call, Mom, if patient's vital signs go outside of a certain range.
Okay. Even though I've seen him and I'm waiting on a CT scan?
No, I didn't know that. Okay, but he's breathing really quickly still. So can you alter the criteria so that we don't have to call a Met call?
So what do you want to do? His respiratory rate, this number is 33. It's the same, but it's within, it's outside of the criteria of what the ward is allowed to tolerate without calling an emergency call. So what you could do is you could alter the criteria.
Until I get my
But
CT
now
scan.
ICU's here. So I've just come from ICU. My name's Frank, and so I'm just here for this Met call.
We're just waiting for a CT scan on this patient. He's 4 days post-op. He's had some pain in his leg. He's got some heart pain. We're thinking he might have a blood clot. We're just waiting for the CT scan.
Yeah, really good. I agree. I think we should do a chest X-ray. Just rule out a few other things, and we can get that. We can get a mobile chest X-ray. We can get one up from radiology. Have a look.
They're actually just around the corner, and they'll just do it for you right now.
Oh.
Good lungs, bad lungs.
The lungs look good to me. They're clear.
The lungs are clear.
Frank agrees. So I think we've got a normal chest X-ray and some normal blood works at the Met call. It sounds like you're doing the right thing. Good job. I like your differential. Keep doing the good work. All right.
Thank you very much.
You might want to
I
let
like
your surge reg
You're
know
the
when you get the
nicest
CT.
person I talked
Okay.
to today. I like you.
ICU, always the nicest.
I'm 4 hours late for James.
Oh, Mom.
I tried to get there, you guys. I hope he's sleeping and not dead. All right.
He's asleep.
Okay, so I'm gonna do whatever this fluid check that you guys have never actually taught me how to do before. So I want to let him sleep if I can.
I would probably just sneak in there, put my stethoscope on the chest while they're sleeping, and have a very quick listen, and then his chest sounds good.
Maybe
Sounds
look at
good?
his obs.
Okay, all right,
Look at
good. He's done.
right, you're
Let's see, who have we done? Gary Garbles finished his discharge.
It's now
We'll hear about him. Peter Peterson.
4:30 a.m., Mom.
It's 4:30
You maybe
a.m.
have a chance to sleep, or do you want to do those jobs?
No, I'm not going to sleep. I don't. What I just started at 9. I don't need to sleep. At 25, blood sugar level is 4.8. Please review. And bed 45. Vomiting. What is what is that?
Just really concerned.
All right, Mom. You've done good.
I'm not.
You made it through.
I'm Dr. Tommy Thompson. I'm back from my dinner.
It's now 8 a.m. It's now 6 a.m. Let's say it's an early dinner.
How was your night?
It was quite frantic, and we need to talk. We need to go and have a check with Peterson right away. Worried about him. We don't even know if he has a stoma or not. It's the guy with the
Oh, right. Yeah, what's going on with his urine output?
No, he hasn't urinated in 2 years, according to my notes.
I think it was 2 hours.
I think it was 2 days. Was it 2 days? Well.
Okay. All right. I can go and see him.
Yeah, and then we've got Kyle McKyle. He's having surgery, and insulin's being withheld, and somebody needs to check on him.
Oh, I handed that job over to you.
Yeah, well, it didn't get done.
Oh. Remember when you were grilling me about all the things I didn't do?
Yeah, well, if you'd have done everything you should have done on your shift, I wouldn't have been as busy on mine.
Give it everyone. All right, okay, I can do that. Yeah.
All right,
I kind of wanted you to call Endo, but okay.
I was too busy. So Sally's going to surgery for gallbladder.
Oh, she's got a gallbladder problem. Okay.
Yeah, James Jameson. I did his fluid review and he was fine.
Oh, nice.
I did it around 4 a.m. So he was good at 4 a.m. Gary Gargles. Yeah, he's going home today and he needs his discharge stuff done. And we've got a couple of other people. We've got Fred McAnnis with chronic kidney disease. We're waiting on an ECG for him. And we have Joey Joason. And yeah.
What's going on with JoJo Joeyson?
I can't remember what was going on with Joey.
This is Joey.
Oh yeah, Joey's he's got the blood clot in the leg, so we are waiting on a CT scan for him too.
Oh, nice. All right, perfect. I'll follow that one up.
Good job, Mom.
Yeah, you made it through. Good job. Round of applause.
Yay.
You don't have to speak to the surge reg anymore.
How was that?
That was too many people calling. What was with the person with something in their nose?
You did really well, though.
Yeah.
And you remembered everything. I thought you were going to forget about that ECG.
ECG, yeah. Well done. You handed over the ECG for the high potassium. I've ignored the chat for quite a while, actually.
No, I no longer want to be a doctor. At least I don't want to be a doctor.
Night shifts are really difficult.
It was a busy shift, though, Mom.
I probably wouldn't actually talk to the surgeon the way I talk to you. I mean, is that really what they do?
It would not have gone that way, I can tell you that.
They come in the morning. Is that what they do?
You're not wrong. Like, if there's an emergency surgery and they have to come in, they'll do it.
It's often even more risky to do these operations at night because you're getting a surgeon who's trying to sleep, as you found out a few times.
Yeah.
And then you're getting these theater staff in, and it's not as well planned, and the patient's not as prepped for it either.
Well, that was kind of fun. That was fun.
Yeah, you did really well.
You had fun names for them. I like Joey.
That guy's name was crazy.
Should we get on to our better deed?
I think we should get on to better deed.
Better deed. I don't know.
Shall I go first?
All right, you go first, Mom.
Okay,
what was your good
my
deed?
better deed is I helped somebody who's looking for a job. I spent about 2.5 hours yesterday redoing their resume and their cover letter for them.
It's a pretty good deed, Mama. Do you have a good deed?
It has to be outside of work.
It can't be I saved somebody's life last night.
I bought the team coffees on night shift.
That's a good deed. That's nice.
Yeah.
And Tommy, what was your deed?
I stayed late to help a medical student learn how to do a procedure.
That's
I stayed
nice.
about 2 hours late to help them.
What was it?
Catheter.
2 hours.
Yeah. It's very slow.
Slow catheter.
2 hours. It took them 2 hours to put in a catheter.
Nah, it's more so just like the logistics, finding everything for the procedure.
All right, what does the chat say?
Mm.
I don't see the
Well,
chat.
I don't think we win.
Yeah, I don't think we win. All right, Chad, who wins? Owen, I think
Really
you
good
win.
questions.
What?
Well, there's 2. I think it's a tie right now, actually. 2 for Owen, 2 for Mom.
No way. I don't win.
Wants to
If
give
it's
it
a
to
tie
Mom.
for us, that means there's only one loser.
Oh.
Wow.
And Owen gets to
you
pick
know that
the
if
song.
you keep picking my mom, she'll never have to sing.
Owen
Oh, you
gets
won't
to
get
pick
to
the
hear it.
song.
Ooh.
You can
Well,
think about it, Owen, and tell us at the end of the show.
All right, so because I lost in one of the 20 previous times, I have to do this song. It's by Crowded House.
And you
which is
also owe
Zoom.
your granny a song too.
And I do owe my granny a song. We'll play us out with that one afterwards. How's this go? Oh yeah, okay, I remember. Somewhere deep inside, something's got a hold on you. And it's pushing me aside to stretch on forever. And I know I'm right for the first time in my life. And that's why I tell you, you better be home soon. Stripping back the coats of lies and deception. Back to nothingness, like a week in the desert. And I know I'm right for the first time in my life. That's why I tell you, you better be home soon. I'll leave it there.
That was lovely. That was so
All right.
nice.
All right, that's a nice song. I like that one. You have it ready?
Have you done Ray Charles before?
Don't know if we have done any Ray Charles.
Georgia on My Mind.
Georgia on My Mind.
That's
All
a
right,
good
that's
one.
the song. Am I doing it or is Mom doing it?
Maybe
That's
it's a
okay,
duet. Maybe it's a duet.
Oh, a duet. Yeah, duet's good.
All right, maybe we try to do a duet.
All right. Georgia
All
on
right.
my mind. I write this down.
Thanks everyone for coming along.
Thanks everyone for coming
Good
on.
show.
So here
Had
is
a
a
great time.
song for Gran by Dr. Tommy. Here we go.
And Owen's on this one, actually.
Oh, and Owen too? Both.
Hold it.